Hello, today we're joined by Dr. Alexandros Georgiadis. He is a board-certified neurologist with South Texas Health System Clinics and the stroke medical director at South Texas Health System McAllen to talk about strokes, a leading cause of death in the country. Thank you so much for joining us today. Now, every 4 minutes, someone dies of a stroke in the U.S. according to the CDC. What exactly is a stroke?
Usually because a clot has traveled from the heart or from one of the arteries in the neck, has traveled inside the brain and has blocked that artery. So because of that clot being there, there's no blood flow to a certain part of the brain, and that part of the brain starts dying.
All right. How common are strokes in this community?
Strokes are very common in this community because unfortunately the risk factors, the most important risk factors for stroke are very prevalent, very common in the valley. So, and we're talking about high cholesterol, smoking, poor nutrition habits, hypertension, diabetes. All of those diseases are more common in the valley than in other parts of the country, unfortunately.
Now let's talk a little bit about the warning signs of a stroke. And there's the acronym that medical experts use, and it's Be Fast. Can we talk a little bit and touch on what should we be looking out for if you think you're having a stroke or you see somebody who could possibly having one?
Yeah, well, strokes usually cause symptoms on one side of the body because the brain is divided into two halves, and each half takes care of the opposite side of the body. So the right part of the brain makes the left part of the body move. Now, so symptoms will usually be confined to the one side. Usually you'll have things like numbness or weakness of one side of the body. So for example, your hand might become numb, you might be unable to move your fingers, you might drop whatever you're holding, your leg could become heavy, you might start dragging it. The face might become droopy, you can have like saliva, coming out of the edge of your mouth, and the face can look crooked. These are like very common. Then speech disturbances, people might start speaking slurred as if they were drunk, or they might have trouble finding words, so they might be unable to come up with a word they want to use. These are the most common ones. I mean, there's also visual changes. Sometimes your vision might become dim, you might start seeing blurred or double. These are the main things.
All right, so those are the ones that they should look out for. And medical experts say minutes, even seconds matter when it comes to a stroke. How important is it to act quickly in the event of a stroke? If you notice that you're any of those symptoms or a combination of them, why is it so important to act fast?
Well, it's extremely important because, like we said, what happens is that a blood clot is blocking an artery, so there's no blood coming through. The brain starts to die, and every minute that goes by, more of the brain cells are dying. So the sooner you react, the better off the patient's going to be. The thing is that if the damage is not really very extensive, then patients are more rehabable. They're easier to train afterwards. They can go to physical therapy and learn again how to move. They can have speech therapy, learn again how to speak. But the more damage has been done, the harder it is afterwards.
And the greater the risk of the debilitating factor of the stroke.
Exactly.
Now, STHS McAllen is a comprehensive stroke center. What exactly does that mean for the community?
When you're having an acute stroke, there's two things that can be done to prevent the stroke from becoming worse, or from, to reverse the stroke even. The first one is if you present to the hospital within 4.5 hours from the time of onset of symptoms, we can give intravenous medications that can help bust clots and reestablish blood flow. So that happens only within 4.5 hours. So you see, if you're late, if you waste time, you're not going to be able to get that treatment. But even more importantly, in case someone's not eligible for that, or in case that treatment doesn't work, we're able to go inside the arteries and mechanically retrieve blood clots and reestablish blood flow. So this is a procedure called mechanical thrombectomy, and it's the most advanced intervention that exists for stroke, and we're ready 24/7 to provide that.
All right. And now, when it comes to prevention, obviously we talked about controlling any diseases that you may have, any illnesses, conditions, but what are other things that we can do to just make sure that we're staying healthy overall and that we're hopefully preventing the risk of a stroke?
When it comes to high blood pressure and diabetes, if you control them, and then it's like not having them, right? So these are treatable conditions. If your blood pressure is high, but with your tablets it's not anymore, then you're fine. Same thing with diabetes. If your blood sugar is controlled with whatever medication you're getting, then it's like you really don't have that problem. Then everyone knows what a healthy diet is: avoiding red meats, avoiding fats, avoiding processed sugars. It's pretty much well known. Keeping move around, move as much as you can. Avoid using the car. Exercise. This is. It's basically things that are well known, but just hard to implement.
Yeah, that's the thing, is implementing them. Yeah. Well, thank you so much, Dr. Georgiadis, for your time. We really appreciate it. To learn more about strokes and how to prevent them, as well as the stroke care available at South Texas Health System, please visit our website at southtexashealthsystem.com.